The problem that we are facing right now is that the healthcare system in the United States is fragmented, and there is not a central agency that governs the system, but instead it's a mix of public and private companies. The United States healthcare system is financed by employers, the government, or individual self-funding. In this system, access to healthcare services is based on insurance coverage. Employers provide most Americans with healthcare insurance. However, if an employer doesn't offer a health insurance plan, the employee is responsible for shopping an insurance plan or opt to not buy one. The delivery of healthcare is through providers who offer their services to patients in exchange for payment. For those covered by private or public health insurance plans, providers independently will bill the insurance for their services. However, medical services here in the United States are very costly, so many people cannot pay these medical services without insurance. For that reason, the United States cannot insure all people, resulting in a country with an insured population. The lack of access to health care is a public health. The solution of this problem would be the single-payer national health insurance, also known as Medicare for All. This is a system in which a single public agency organizes and finances health care, but the delivery of care remains mostly in private hands. Under a single-payer system, all residents of the United States would be covered for all medical services, including doctor, hospital, preventive care, long-term care, mental health, reproductive health care, dental, vision, prescription drugs, and medical supply costs. Here we have two of our members from Kentucky during the St. Patrick's Parade before the pandemic. We try to get advantage of any opportunity that we have to spread the word and advocate for Medicaid for all. Now let me introduce our organization. We are the Physicians for a National Health Program. This national organization is seeking a national change in the healthcare reform of the United States. We have more than 20,000 members and chapters across the country. We organize physicians, medical students, and other health workers. We are the only national physician organization in the United States dedicated exclusively to implement a single-payer national health program. This organization exists because we believe in access to health care for all. Since 1987, we have addressed the lack of health care access for all residents in the United States and advocated for a single-payer system. We are a nonpartisan, independent, and voluntary organization. We are funded by our members' dues and contributions, any grant from progressive funder. We do not accept grants that come from pharmaceutical companies or for-profit entities. Our mission is to educate physicians, health workers, and the general public on the need for a comprehensive, high-quality, funded healthcare program that is equitable and accessible for all residents of the United States, and our goal is to restore the primary mission of physicians acting as a professional advocate for our patients. Now let's hear from our member Tom about who is and who is not in the table addressing this issue, because it contributes to an equal distribution of coverage and
Many groups organize around the issue of a single-payer system. Some oppose the creation of a single-payer system, and others support it. Each of these groups has the potential to be either an ally or an opponent of Physicians for a National Health Plan. Let's talk about the allies of Physicians for a National Health Plan. Many organizations are allies of PNHP. In fact, PNHP lists nearly 30 organizations with which they work on their website. Some of these groups are part of the medical community. However, PNHP also works with many groups outside of the medical community with which they share their views. PNHP also has two subsidiary groups, one for non-medical professionals called Healthcare Now, and one for medical students called Students for a National Health Program. About 1/3 of PNHP's allied groups are medical interest groups. A complete list of these groups follows on the next slide. However, not all medical interest groups support a single-payer system. Most notably, the AMA, the single largest interest group for American doctors, is opposed to a single-payer system. Although the AMA has been opposed to a single-payer system for quite some time, this may not always be the case. In 2019, the AMA had a vote on the issue, narrowly maintaining its opposition 53 to 47. In the last decade, support for a single-payer system has been growing, both in the general population and among the medical community. It seems likely that eventually support for single-payer within the AMA will increase to a point that their official stance will change. However, there's no telling how long this will take. Here we have a list of PNHP's allies within the medical community. These groups represent a diverse group, both demographically and professionally, including doctors, nurses, medical students, and public health professionals. In addition, the American Medical Women's Association represents female doctors and medical students, while the National Medical Association represents doctors of color, and the Islamic Medical Association represents doctors of the Islamic faith. PNHP also lists 20 allies which are not linked to the medical community. Some of these groups are political, such as the Americans for Democratic Action and Progressive Democrats of America. Support for a single-payer system is primarily on the more liberal side of the political spectrum. Some of these groups are labor unions. In addition, many of these groups advocate for stakeholders, namely those who would most benefit from a single-payer system. For instance, the National Healthcare for the Homeless Council. There are also senior groups like the Older Women's League and the National Council of Senior Citizens. Finally, some are consumer groups, such as the Consumers Union, the Consumer Federation and the Consumer Federation of America. These groups advocate for the interests of consumers. Their involvement likely comes as a result of the fact that medical care and insurance coverage in the United States are highly commoditized. Only legislators can introduce and pass the kind of legislation needed to create a single-payer system. As a result, it's vital that PNHP work with or advocate to legislators if they hope to advance their policy goals. The Medicare for All caucus is a caucus in the U.S. House of Representatives which supports the creation of a single-payer system. It was created in 2018 by 70 progressive Democratic representatives. The Medicare for All Act, H.R. 1384, was introduced by the co-chair, Pramila Jayapal. Although there is little to no support for a single-payer system among Republican legislators, there is some degree of support amongst Republican voters. According to a poll by the Pew Research Center, up to 15% of Republican and Republican-leaning voters support a single-payer system.
Disparities among
Now let's talk about stakeholders.
vulnerable populations.
While everyone in the U.S. would be affected by the creation of a single-payer system in one way or another, possibly the most important group of stakeholders would be the uninsured and underinsured. Currently, there are roughly 28.9 million Americans who are uninsured. They are faced with either foregoing health care or incurring serious expenses when they need it. Uninsured Americans are also prone to developing more severe health problems due to not having access to care. By providing health care to all Americans, regardless of income or job status, a single-payer system would also increase the equity of health care in the United States. Healthcare providers, such as doctors, nurses, aides, and technicians, are another important group of stakeholders in a single-payer system. Many of the groups that represent HCPs support a single-payer system. For instance, the ANA. The ANA would be an important ally of Physicians for a National Health Plan, as they represent over 4 million American nurses. It should also be noted that some healthcare providers don't necessarily support a single-payer system. One of the most notable groups against it that represents HCPs would be the American Medical Association. Another important group of stakeholders would be private insurers. Insurers profit enormously from insurance premiums. Therefore, these groups have an interest in maintaining the status quo. In a single-payer system, private insurers would likely lose most of their policyholders if they are outright banned. Therefore, a single-payer system represents an existential threat to private insurers. Insurance companies and insurance industry groups have organized extensively in opposition of a single-payer system and healthcare reforms in order to continue profiting from the healthcare needs of Americans. Employers are another important group of stakeholders. 150 million Americans receive their health benefits through work. The cost of insurance premiums can be a significant burden for employers. In fact, health insurance benefits cost employers over $15,000 per employee per year on average. This money could be used to increase wages or provide for larger contributions towards retirement funds. Groups like Business Leaders for Healthcare Transformation support a single-payer system. Business Leaders for Healthcare Transformation asserts that our current healthcare system imposes costs on businesses and harms competition, which in turn hurts both employers and employees. Business Leaders for Healthcare Transformation states that their goal is a healthcare system that covers everyone with essential services and care, regardless of their income, background, or job status. Hospitals and hospital systems also hold a major stake in this issue. The concerns of many hospitals and hospital systems stems from the fact that Medicare and Medicaid reimburse at a lower rate than some private insurers. In fact, some plans reimburse at twice the rate of Medicare. As one of the groups that profits the most from the healthcare system in the U.S., hospitals and industry groups which represent them are strongly opposed to a single-payer system. In addition, taxpayers would also be affected by a single-payer system. Although hospital and industry groups often claim a single-payer system would increase costs and thus taxes, there is evidence to the contrary. Currently, America spends more per capita on healthcare than any other country. In a review of the literature, Kaya et found that a single-payer system would likely reduce healthcare costs in the U.S. The main source of these reductions would be by eliminating complex billing systems and the profits of the insurance industry. The pharmaceutical industry also holds a stake. Currently, drug prices in the U.S. are some of the highest in the world. The Medicare for All Act contains provisions to reform the pharmaceutical industry. These include creating a national formulary and encouraging the use of generic medications. This would reduce drug costs for hospitals and patients, and therefore reduce the profits for the pharmaceutical companies. The pharmaceutical industry makes the argument that their profits are necessary in order to recoup the money they invest in new drug development. However, it is entirely possible that increasing access to currently available drugs would have a larger impact on the health of Americans than the development of new drugs would. Nonetheless, the pharmaceutical industry and its groups have organized with insurers and hospitals to fight a single-payer system. Moving on, let's talk about challenges and opponents. The Partnership for America's Healthcare Future is a major opponent of a single-payer system. Formed in 2018, the PAHCF represents 120 industry groups from the hospital, health insurance, and pharmaceutical industries. These groups include the American Hospital Association, the Federation of American Hospitals, Blue Cross Blue Shield, America's Health Insurance Plans, and the Pharmaceutical Research and Manufacturers of America, as well as the American Medical Association, although they later left. The PAHCF argues that a single-payer system would raise costs and thus taxes. However, such arguments were made when the Social Security Act was proposed in 1965 and about the Affordable Care Act, and literally every other attempt at healthcare reform in between. The PAHCF spends and lobbies extensively against a single-payer system. Their efforts include media advocacy, ads, Twitter posts, and videos. The PAHCF is also considered a dark money group due to not having to report the sources of their funding. Political opposition is also a major stumbling block of a single-payer system. As mentioned earlier, legislators can be important allies or powerful opponents to a single-payer system. Political opposition is not distinct from the profits of the hospital, insurance, and pharmaceutical industries. These companies and their interest groups frequently make contributions to the campaigns of politicians who support their goals. These contributions can total in the millions of dollars. Campaign contributions such as these essentially allow these groups to buy political representation with their vast resources.
Around 26 million or 8% of people that do not have insurance.
Next, we are going to go into more detail about PNHP's general approach of their advocacy campaign. So, what is PNHP trying to accomplish? They aim to enact a universal, comprehensive, single-payer national health program within the United States. And they are actually the only national physician organization within the U.S. that solely advocates for a single-payer national health program. And they've been doing so for about 34 years. So overall, they campaign for a total reform of the U.S. healthcare system. The current system, it's a cost-driven and fragmented system that oftentimes leave many uninsured and or with costly bills. So the PNHP, they endorse bills in both the House of Representatives and the Senate that would establish a single-payer national health program. These are the Medicare for All Act of 2021 and Medicare for All Act that was both within the House and the Senate. Furthermore, they educate physicians, other healthcare providers, and the general public about the advantages of a single-payer system. So now we'll go into even more detail about what exactly they do. PNHP advocates on behalf of others, whether it be for those who are negatively affected by the current healthcare system, those that may not have any health insurance at all, or even adequate coverage, those that have experienced the exceedingly high costs of our current system, and so on. PNHP members, they enact various advocacy tools that might include promoting a single-payer national health system within their own communities and places of work, conducting research on our nation's need for healthcare reform and overall healthcare crisis. They also contribute to scholarly articles, to medical journals. They coordinate speakers and forums. They participate in town hall meetings and debates, and they even appear on news programs. So what exactly is PNHP advocating for? They advocate to win real improvements in people's lives and to alter the relations of power. PNHP wants to see real improvements in people's lives. They believe that it is the right of all people to have access to high-quality health care and that it should be provided equitably as opposed to being sold as a commodity. They believe that equitable accessibility to health care includes the removal of barriers to adequate health care, which is a current issue faced by those that are uninsured, those that can't afford it, minority populations, and immigrants, both documented and undocumented. PNHP members view the campaign for a universal single-payer healthcare system as a part of the campaign for social justice within the United States. PNHP also advocates to alter the relations of power within the U.S. healthcare system. They oppose for-profit and corporate control of the healthcare system, and they endorse public administration and single-payer financing of the healthcare system in the U.S. Furthermore, they oppose how the current healthcare system is run that tends to maximize the profits of investors as well as the incomes of executives instead of serving patients' actual needs. And lastly, they aim to restore what they view as the primary mission of physicians, which is to act as professional advocates for their patients. So after reviewing all of these advocacy tools, it is clear that PNHP members have a comprehensive advocacy approach to fight for their cause of a universal single-payer healthcare system.
Legislative and regulatory advocacy are mainstays of PNHP's mission and work. PNHP publicly supported a bill in both the House and the Senate to help bring health care to all Americans. Also, helping shape public opinion is an important part of PNHP's advocacy. On March 17, 2021, Representatives Pramila Jayapal and Debbie Dingell introduced the Medicare for All Act of 2021. It would be a landmark piece of legislation and would establish a single-payer national health program in the United States. All medically necessary care would be provided free at the point of service, without premiums, copays, or deductibles. Medicare for All would reduce national health spending. It would eliminate the waste and profits of commercial insurance, streamline the administrative and billing burden on doctors and hospitals, and slash drug costs by negotiating prices for medications and equipment, overriding drug patents when necessary, and establish a national drug formulary that promotes the use of generics. The program, according to the Physicians for National Healthcare program, would be implemented over a 2-year period. In the first year, current Medicare enrollees can utilize expanded benefits such as dental and vision care. And after year 1, the program would automatically enroll ages 0 to 18 and 55 and older, and also offer a Medicare transition buy-in plan. After year 2, according to the bill, everyone would be covered. According to the bill, 1% of the budget for the first 5 years would be to assist displaced insurance workers, and PNHP endorsed this bill and urged Congress to move quickly to address the decades of health-related injustices that have been made even more apparent by the COVID-19 pandemic. Senator Bernie Sanders introduced substantive single-payer legislation in the U.S. Senate. The Medicare for All Act, filed on April 10, 2019, would establish a universal single-payer healthcare program to ensure care for all residents of the United States. Based on PNHP's analysis, the Medicare for All Act of 2019 would be a significant step forward in the fight for single payer. Taken together with Representatives Pramila Jayapal's Medicare for All Act, it would transform the U.S. healthcare system, making healthcare a human right, according to PNHP. Based on many decades of careful analysis and research by PNHP, they have recommended several improvements to the Medicare for All Act that would save even more money and improve patient care. The first would be to fund hospitals to global budgets with separate funding for capital projects. A global budget is a lump sum paid to hospitals and similar institutions to cover operating expenses and eliminate wasteful per-patient billing. Another recommendation is to end value-based payment systems and other pay-for-performance schemes. Bernie Sanders' bill continues current flawed Medicare payment methods. Studies, according to PNHP, show these payment programs fail to improve quality or reduce costs, while penalizing hospitals and doctors that care for the poorest and sickest patients. PNHP recommends that Senator Sanders end all value-based payment. PNHP also recommends that the bill establishes a national long-term care program. Senator's bill includes home and community-based long-term services and supports a laudable improvement from the 2017 bill. However, institutional long-term coverage for seniors and people with disabilities will continue to be covered under state Medicaid plans, complete with the maintenance of effort provision. PNHP recommends that Senator Sanders include institutional long-term care in the National Medicare program, as it is in Representatives Pramila Jayapal's single-payer bill. PNHP also recommends that investor-owned facilities are banned. For-profit healthcare facilities and agencies provide lower quality care at higher costs than nonprofits, resulting in worse outcomes and higher costs compared to nonprofit providers, according to PNHP. Medicare for All should provide a path for orderly conversion of investor-owned, for-profit healthcare providers to not-for-profit status. And finally, PNHP's last recommendation to improve Senator Sanders' bill is to fully cover all medications without copayment. Senator Sanders' bill excludes cost sharing for healthcare services. However, it does require small patient copays, up to $200 annually, on certain non-preventative prescription drugs. Research shows that copays of any kind discourage patients from seeking needed medical care, increasing sickness and long-term costs. Experience in other nations prove that they are not needed for cost control. Influencing public opinion is another important part of PNHP's advocacy mission and toolbox. Every month, PNHP focuses on specific, concrete kitchen table issues in order to help develop the public support necessary for major legislation changes. In 2020, PNHP focused the kitchen table issues on elections. YouTube videos and social media provided voting guides for the electorate as they considered where candidates stood on healthcare. Candidates were able to be held more accountable for their healthcare plans because the electorate knew which candidates supported healthcare as a human right. Other issues that are worthy of kitchen table talks in the future would include COVID-19 relief, mental health, and generic drug prices.
Now we are going to show you some examples on how we advocate for a single-payer system.
A background fact sheet for PNHP tells us why the motive of the advocacy group is so important. It touches upon facts and details which motivate PNHP to take action. Attached is a snapshot of our background fact sheet advocacy tool. Over 31 million Americans lacked health insurance in 2020, and this number is expected to increase. At least 45% of US adults aged between 19 and 64 are underinsured, meaning they have inadequate and insufficient protection from financial and health distress in the event of a serious illness or injury. On an average, other wealthy countries spend about half as much per person on health than the US. Per capita spending reached about $11,500 in 2019, whereas Switzerland, which has the world's second most expensive healthcare system, had a per capita spending of about $7,700, and Canada, our immediate neighbors, with an NIH system, had a spending per capita of about $5,400. The single-payer national health insurance would save at least $375 billion annually on paperwork and administration, which is enough to cover all the uninsured. It is enough to eliminate all copays and deductibles, and it is also enough to upgrade coverage for the Medicare enrollees. No other reform can slash administrative costs in the manner that the single-payer system can, and that is why it is important to have the single-care system which is being advocated by PNHP.
We ask our members to call or email their representative and senator every time that there is a bill in the Congress. In many cases, we provide this script for people to feel comfortable and to have an idea at the moment of the call or when they're going to email. The person will introduce themselves, then mention to co-sponsor the bill, and then important to mention 2 or 1 fact about the lack of insurance or how Medicare will improve people's health outcomes. If you have a compelling story that links to this issue, it would be great. Of course, if you feel comfortable to share that. And finally, ask your representative and senators to support that specific bill. And if your representative or senator is already co-sponsored, thanks them for their support and ask them to put for hearing in the current session of Congress.
Our next advocacy tool is a press release which was released a few days back by the PNHP. A 24,000 member of Physicians for National Health program, a non-profit single-issue organization advocating for a universal, comprehensive, single-payer national health program, endorsed the Medicare for All Act of 2021, filed on March 17th by Pramila Jayapal and Debbie Dingell, along with 114 additional co-sponsors. The president of PNHP urged that it was impossible for physicians to provide care in a fragmented, broken, and profit-driven system. She reiterated the fact that doctors have for long watched patients receive no or very delayed care due to inability to pay. She strongly recommended that subsidizing commercial insurance to cover uninsured Americans, as was done in the recent American Rescue Plan, was an expensive and dangerous approach. The pitfalls of commercial insurance have negative effect on patient health, which are overlooked in Congress, where the fight lowering premiums steals the limelight. The Medicare for All Act is the only plan that puts the needs of patients ahead of everything else. It guarantees health care for all in the US, access to choose a hospital and medical provider, and no financial firewalls to stand in the way of care. Medicare for All also covers all medically unnecessary services. Example, hospital and doctor visits, dental, vision, hearing, mental health, and reproductive care. It also accounts for long-term care, ambulatory services, and prescription drug services. We at PNHP strongly believe in using strong images to promote and advocate for insurance for all. Our aim is to bring all citizens under one insurance system and provide them with affordable and accessible quality of care. Social media is an important tool of advocacy, and we use powerful images and hashtags to reach out to people. We use hashtags on Facebook, LinkedIn, Instagram, and Twitter. The hashtags we use are Medicare for All, No More Paperwork, Save Billion Bucks, Rely on Us, Where People Matter, Dead Deaths, and Insurance for Life. Some of the other methods of social media advocacy are asking representatives to support and co-sponsor the Medicare for All Act. We can urge them to join the conversation by tagging them in official Twitter pages. We can share images of political representatives who support the cause. We can share and reshare and advocate their tweets. We can share strong images of common people at rallies, sharing posters of Medicare for All, saving lives, private insurance killing people. For the last part of our social advocacy, we used this very famous meme of Bernie Sanders sitting and advocating and providing for mittens for all and Medicare for all. Thank you.
The prevalence of chronic diseases appears to be higher in people who cannot afford an insurance plan and are more likely to postpone taking care of their health. According to the CDC, chronic diseases are responsible for 7 of 10 deaths each year. People with multiple chronic diseases are more likely to be hospitalized, are at greater risk of dying prematurely, and make up 3.0 trillion of the annual national healthcare costs. Therefore, we will continue advocating for a single-payer system that will provide access to all and improve the health of every resident of the United States.